Hey everyone, welcome back to CTLA4 Chronicles. I'm going to do, I think, 2 videos today. The first one's going to be just kind of an update on how I am doing, what our next steps are and stuff. And then the next video is going to be a little bit more in depth about um, my port placement and the complications that came with this, and what we're kind of dealing with now with that. But again, like 2-part video on this. Okay, let's jump back into it. Hi, my name is Jane. For those of you who are just joining, I am just over a year out from having a bone marrow transplant for a really rare genetic disease called CTLA4 haploinsufficiency. And I was going to die from disease progression of the CTLA4 without the transplant. I was maxed out on all of my medications. And I just kept getting sicker and sicker. I was walking with a cane. I really couldn't get out of bed most days. I wasn't working. It was not great. So I had to have a bone marrow transplant, and things were really good for a few months. I had the best summer I've had in years, and that was amazing. But sometime in the end of September, I started to develop some like real serious symptoms of like GVHD, but really it looked like heart failure, like something wrong with my lungs. And thankfully we ruled all that out. But now I have been diagnosed with chronic graft versus host disease, and it has been a battle. It's been a challenge. It's not fun. It's hard. It's really painful. And so I'm navigating that right now, and that's tough. So the transplant cured the genetic disease, the CTLA4 haploinsufficiency. And it also cured all of my autoimmune diseases that I had, which I think I was at like 9, but I feel like every time I count it out when I tell people it's higher than 9. And the last one that I developed before transplant was type 1 diabetes out of the blue at 30 years old. So that was wild. Now with the GVHD, they use a grading scale similar to cancer where it's grade 1 through 4. And my team in Boston had originally said it was probably maybe a grade 2. But when I met with the specialist at Yale, he said that I'm like moderate to severe, more on the severe side or like bordering there. So I don't know what my grade is yet, but I believe it's going to be higher than a 2, and I'll find that out on Monday. So that's a lot to process in itself. The type of GVHD I have is of my fascia, which is a connective tissue between the skin and the muscles. But they also believe that I have like myositis from this as well, which would be GVHD in my muscles and in my joints. It's kind of all together. And it's just miserable, and I hate it. And like sometimes I hate this body, and I don't really hate it, but I do because it doesn't move the way I want. I can't feel things right. Like my nerves are so compressed, and I already have nerve problems, that like even though I'm touching my face and like my arms and stuff, I can't actually feel it. And like if I have an itch or something and I scratch it, there's no like satisfaction because I can't actually feel it. But it hurts at the same time. Doesn't make any sense. Okay, so for treatment wise, what we've done so far since I think of like May of last year of 2025 is prednisone, which I'm still on. I hate the devil's Tic Tacs, but they're probably stopping me from popping, literally. Jakafi or Jakafi, depending who you talk to, which is a specially made drug for graft versus host disease. Sorry. Rezurock, which is another medication that's specially made for graft versus host disease. And I'm off the Jakafi now. We weaned me off of that in December, but I'd been on that since May, and it didn't do anything for me. So I'm still on the Rezurock. And then I started the axatilimab infusion, and I did my 4th infusion yesterday. And while the infusion and the prednisone and the Rezurock seem to be doing something and like helping with some of the swelling in my body and stuff, it's not enough. And it's really like And it doesn't last long enough either. It's like a week. And by the second week, my body is like already acting funny. But it feels like we're just bailing water out of a sinking ship. Because we can't like get our hands on this. And like one of my doctors was saying the other day that like GVHD is really hard to get your arms around, because they don't really truly understand all of it. And it like doesn't mutate, but it can change. So like treatment doesn't always work long term. It's really actually quite a hard disease to even describe. Um, but the next step in treatment was to get my port placed and to start ECP, which is extracorporeal photophoresis, and that is where they hook me up to a machine and they take my blood out and they separate the white blood cells, the cells that fight infections, from the rest of your blood. And they put the rest of the blood back into the body, and then they treat the white blood cells and stuff, and then they put those back into your body, and it causes this cascading event to get rid of the cells that are causing the GVHD. But it takes like a long time for this to build up and like really work. So they said we're not going to like reevaluate how I am for 3 whole months. So until, I think it brings us into May, because I start this treatment next Monday. So it's a lot. It's a lot to swallow. It's a lot for us to process. And like my face is swollen, but like my right eye is like more swollen today too than my left. I don't know what's going on with my face. I get lots of compliments on my skin because it looks so nice, and it looks like I'm wearing blush, and I'm not wearing anything. It's shiny like this because of the inflammation and disease process. This is not what I look like on a regular basis. And my skin is like so tight. It's like I have had Botox, but it feels like plastic. And like that's how it is on my whole body. My arms feel like that. I was crying the other day with like one of my doctors. And I went to like wipe my tears on my arm, and I can't even get my face. I can't. It's just crazy. And then these stupid, like my skin tearing stretch marks are awful. And they're so painful, and they come like all the way up. You can see them. They're just, ugh. The fact that they happen just from like simple movements and stuff, and my skin getting caught, like it is no fun. So now I'm putting like lidocaine on in my armpits. Palliative care is the one that came up with that, and like it works really well. So I'm just going to be covering myself in lidocaine so I can't feel anything. But that's where we're at right now. I start new treatment on Monday. And we're really hoping to see a difference. Praying to see a difference, because I don't know what our options are after this. And I don't really want to think that far ahead. So this treatment's going to work, and we're going to knock it out of the park. And then this summer is going to be even better than last summer, and that's what I'm holding on to. So thanks for staying tuned. The next video is going to be on my crazy story about this port. That one's going to be wild. Stay tuned.